In this morning's Health Watch, so many of us have been there, that painful burning sensation after you eat. So we're talking about, of course, acid reflux and heartburn. It is a chronic condition known as GERD, short for, doctor, help me out here.
Gastroesophageal reflux disease.
That's right, what he said. Some estimates find about 20% of people in the U.S. suffer from it. I'm surprised it's not more. But when should we be concerned? CBS News chief medical correspondent Dr. Jon LaPook is here, as you heard, to shed some light on this. Dr. LaPook, also, of course, you work at NYU Langone Health. Tell us a bit about, what this is. What happens when we have that acid reflux?
Well, the stomach loves acid, helps with digestion. The esophagus, the swallowing tube, hates acid. Fortunately, there's a valve in between the stomach and the esophagus that stops acid from bubbling up and giving you symptoms. When that loosens up, acid bubbles up, and it can cause all sorts of symptoms, and that's including like heartburn. But it can cause other symptoms too. It can cause asthma, because the acid kind of goes up into your lungs, cough. It can even cause chest pain.
What's the difference between heartburn, acid reflux, and just, I ate too much, I feel gross?
Yeah, well, so I'm a gastroenterologist. People come in, they say, it hurts over here. Well, there's a wide, what's called the differential diagnosis. It could be a lot of things. If you have pain over here, you have to talk to people and get the story. It could be an ulcer. It could actually be a gallbladder disease, which, believe it or not, radiates to there. Or it could be acid reflux. Common things tend to happen commonly, but one of the things I want people to leave here with is, it's called heartburn, right? That word heart is in there, right?
Where does that come from?
So it comes because you can get acid bubbling up and giving you burning, but the other way around can be confusing. So people with heart attacks or angina can feel burning in their chest, and they say, oh, it's just a little bit of agita, no big deal, take antacids. I've had patients do that. So my advice to people is when you have something pop up, especially a new symptom, talk to your healthcare provider about it, because it can be tricky knowing when to do what.
So if someone is experiencing this, how should they know this might be not just acid reflux, but a heart problem?
Well, first of all, know what sort of tends to be the triggers, right? So the triggers are nicotine, alcohol, fatty food, caffeine, chocolate, mint.
Triggers for acid reflux?
For acid reflux. Basically, anything that gives you even an iota of pleasure in life.
Fatty food?
Yeah, that can cause that. Being obese. And you know what? These days, the GLP-1 agonists, like Ozempic and Wegovy and et cetera, they decrease stomach emptying. That's part of the way that they work. And so acid can then bubble up. But I think when you have these symptoms, it can be very tricky to figure out whether it's heart, to answer your question. And I really believe it's so important to have a healthcare provider who you have a great relationship with, you can chat with and say, okay, these are my symptoms. And it's a story. You have to say, okay, what made it better? What made it worse? When did it come on?
So can you treat acid reflux if you continue to eat burgers, beers, and smoke cigarettes?
Well, that stuff is not going to make it any better, but the things that can make it better are things like antacids. So you have pills that actually go into the stomach, or liquid that coats the esophagus and goes into the stomach. The liquid tends to work a little faster, and they hit that stomach acid and they go, tss, right? And they're decreasing the amount of acid in the stomach. If that doesn't work, you have these pills, you've heard about them, that actually stop the acid from making acid, and they can get increasingly powerful, and they can be more important in the long run for controlling long-term symptoms. But bottom line here, talk to your healthcare provider. This is tricky to know when to get an upper endoscopy, when you actually look to see what's going on. It can be some serious stuff, or most commonly, it's something that can be treated with medication, diet, and weight loss.
Amazing. You're so clear at this stuff.
We're out of time. Next time I want to know if you're pregnant and you have heartburn, if it means the baby has a lot of hair. But we'll get to that in the next Health Watch.
I love that. Dr. LaPook,
No.
thank you very much. That's definitive, the doctor said.